Hi, I'm Shauneen, and in this video I'm going to explain the parts of Medicare, which will give you a basic understanding of how Medicare works, and also how and when to enroll in Medicare. Medicare is a federal health insurance program for people who are age 65 or older, also for certain people under age 65 with disabilities, and also for people with End Stage Renal Disease. There are 4 parts of Medicare: Part A, Part B, Part C, and Part D. Part A is for inpatient coverage when you're in the hospital. It includes your room and inpatient hospital care. It also covers skilled nursing facility stays, hospice, and home health care. Part B of Medicare covers outpatient medical, such as doctor visits, lab work, tests, surgeries, durable medical equipment, and preventive services. For most people, there's no cost for Part A. You can get premium-free Part A if you receive retirement benefits from Social Security, the Railroad Retirement Board, or if you're an active or retired federal employee. If you're eligible for those retirement benefits but haven't filed for it yet, then you shouldn't have to pay a monthly premium for Part A. If you or your spouse worked at least 40 quarters in your lifetime and paid taxes, then your Part A is considered paid up and you'll pay $0. If you're under the age of 65, then you can get premium-free Part A if you've received Social Security or Railroad Retirement disability benefits for at least 24 months, or if you have end-stage renal disease. If you don't qualify for premium-free Part A, then you can buy it. The cost will depend on how long you or your spouse worked and paid Medicare taxes. Also, if you have to buy Part A and you don't sign up for Part A when you're first eligible for Medicare, then you could have a late enrollment penalty. Most people will have to pay a monthly premium for Part B. How much you pay for Part B will be based on your income, which is reported on your tax return 2 years prior. Most people will pay the standard premium amount. If your income is above a certain amount, then you may pay more based on what's called the Income-Related Monthly Adjustment Amount, or IRMA. Certain people with lower incomes may qualify for assistance that covers the Part B premium for them, so be sure to watch our video about the Medicare Savings Program to see if you might qualify. The premium payments for Part B will be deducted automatically from your Social Security, Railroad Retirement, or federal employee benefits. If you don't receive any benefits yet, then you'll get a bill for Part B. You can send in quarterly payments, use online bill pay, or set up a monthly payment with Medicare Easy Pay. If you don't sign up for Part B when you're first eligible, then you may have to pay a late enrollment penalty. Some people will get Part B automatically, and some people will have to sign up for Part B. If you're getting Social Security, Railroad Retirement benefits, or if you've been on disability for 24 months, then you'll be signed up for Part B automatically. If you're not receiving retirement benefits yet, then you will have to sign up for Medicare Part A and B. In some situations, such as if you're still working and have employer group insurance or insurance through your spouse, then you may want to postpone your initial Medicare open enrollment until a later date without any penalty. You may be able to delay signing up for Medicare and save the cost of your Part B premium. We'll get more in detail on these specific situations with employer coverage and Medicare in another video. Individuals already receiving Social Security or Railroad Retirement benefits at least 4 months before the eligibility date for Medicare will automatically be signed up for Part A and B. If you also receive those retirement benefits and have employer group insurance through a spouse or veterans benefits and you don't want to enroll in Medicare yet, then you'll have a choice to refuse Part B as long as you currently have creditable coverage in place. You'll need to do this before your Medicare coverage is started. You'll receive your Medicare card in the mail about 3 months before your 65th birthday, and there will be instructions for you to opt out. You can also call Social Security and ask to decline Part B. Just be sure to check with your benefits administrator to make sure that your insurance is considered creditable coverage. Otherwise, you could face a late enrollment penalty if you enroll in Part B late or outside of your enrollment window. If you have to sign up for Medicare, there are a couple of ways you can do it. You can sign up for Medicare online, and I'll put a link to our popular video up above. You can call Social Security or go in person to your local Social Security office. Keep in mind that you may have to make an appointment, so call them first. Part C is called Medicare Advantage, which are privately run health insurance plans. These plans are optional, and they're a bundled all-in-one type of plan that includes Part A, Part B, and most of the time Part D in one plan. The plans are typically HMO or PPO network type plans that may work similar to what you've had while working. A Part C Medicare Advantage plan is not a Medigap plan. You can choose either a Part C plan or a Medigap plan, but not both. The plan choices will vary depending on the area where you live, so contact us if you need help finding a plan. Part D is prescription drug coverage. These plans help cover the cost of medications, including shots and vaccines. Part D plans are also run by private insurance companies, but are still regulated by the government. You know, Medicare is great coverage that you paid into your whole life, but it doesn't cover everything 100%. Original Medicare, Parts A and B, pays up to 80% of your medical costs, and there are deductibles and other out-of-pocket costs that you could be billed for. So you should get some type of supplemental coverage in addition to your basic Medicare Parts A and B, whether it's a Medicare Advantage plan or a Medigap plan. You must be signed up in Medicare Part A and Part B in order to enroll in a Part C or Medicare supplement plan. Be sure to watch my other video on the types of Medicare plans. It'll help you decide which supplemental plan will work best for your situation. If you like this video, please give it a thumbs up, and be sure to watch our other videos to help you better understand your Medicare.